welcome back to the Trauma Therapist Podcast. My name is Guy McPherson. My mission is to help trauma therapists be their incredible selves, to be human, to be real, not just a clinician. I'm a big believer in who we are is more important than what we know. And this requires cultivating authenticity, genuineness, and vulnerability, and that requires intention. You can learn more about my courses and workshops by going to thetraumatherapistproject.com. That's thetraumatherapistproject.com. Let's get started. So 5, 4, 3, 2, and 1. All right, folks, welcome back to the podcast. I am very excited to have as my guest back, Dr. Jeffrey Rutstein. Jeffrey, welcome back.
Thank you. Thank you, Guy. Thank you for having me.
You're welcome. So Dr. Rutstein is a clinical psychologist and expert in the treatment of trauma, a certified Hakomi Mindfulness-Centered Somatic psychotherapist, and a meditation teacher who has been in private practice for over 37 years. He's practiced meditation for over 55 years, and that profoundly impacts every aspect of his work. He has devoted his professional life to helping people reduce their suffering and struggle while empowering them to claim their strengths, their talents, and their unique abilities to live a more fulfilling and rich life. In partnership with Sounds True, Dr. Rutstein created and leads the 9-month Healing Trauma Program. This program focuses on empowering individuals through a comprehensive training in polyvagal insight and mindfulness practices that foster grounding, presence, connection, compassion, and healing. Awesome. Welcome back.
Thank you. Thank you.
So I want to remind everyone, share with them where you're from originally and where you are currently.
In terms of physical location?
Yeah.
Okay. So I was born in D.C.
Okay.
I grew up in Maryland, just outside of D.C. And started some of my early trauma work there when in college I was starting to work as a bachelor's level social worker with adjudicated youth. And so I really took a deep interest in what sort of drives people to be driven to behaviors that are either self-destructive or other destructive.
Mm.
And then for graduate school, I came up to New Jersey, and I haven't left. And to my friends in Maryland, I didn't even want to admit that I was in New Jersey. I apologize, all New Jerseyans. I'm a very happy New Jerseyan right now. But at first, Maryland and a lot of other states had not the greatest outsider's view of New Jersey. And so you would only identify what exit you were on.
Right. Being from the East Coast, I'm very familiar with that.
Yeah. Where are you from, Guy?
I was born in Manhattan, lived in Queens, lived in Jersey, tri-state area. Yeah.
All over.
Yeah. One of the things that interests me about the way you speak and the way you talk about what you do is you're very specific. And not everyone is very specific. For instance, just now you talked about, what drove people towards self-destructive behaviors, and in your bio, you talk about helping people reduce their suffering and struggle while empowering them to claim their strengths, their talents, and their unique ability. So there's at least from my perspective, you've honed in on, at least in part, on what drives you. How did you get so specific about that, and what intrigued you about those specificities of people and human behavior?
I think I was always curious. Just as a child, I was lucky to be curious. I was also sensitive, so I took everything personally. So I became a very early student of suffering. The atmosphere in my house was tense, and there was some abuse that occurred at times. And that certainly impacted my relationship to pain and my curiosity about what would make someone else do that to somebody, like to hit someone or to hate them so much. So it came from very personal roots to me. But then as I worked with other people, I saw that lots of other people had different experiences in life, right? And yet, or for example, I knew that a lot of the kids that I work with grew up in very aversive homes, very difficult, very traumatic in many ways, abusive. And it led them to a wide variety of options. So a lot of the kids that I saw were kids that then broke the law and were arrested, and this was part of their quote unquote rehabilitation. But it led these kind of youth to taking violence as one of the courses, or drugs as one of the courses of dealing with their pain or their anger or their shame or whatever the wounds were from their childhood. Other people take different means and they become very masochistic or have to take care of everybody else, or don't want to take up any space at all, or don't want contact with humans, right? So I was intrigued by the way that certain kinds of hurtful experiences produce similarities in behavior and also can produce very extreme differences simultaneously. So I think also, my from a young age, I've been interested in the mind. And so, and especially if you're introspective and anxious as a child, you have a whole lot of time in your mind to kind of begin to see how it keeps going to torturous places. It took me a long, long part of my life to kind of figure out how to get out of those. But it in my own work of working with the kinds of things that entrapped me, I could see a kind of universal mechanism, and our neuroscience just deepens that understanding that we have over these years, that certain experiences you have fundamental impacts on the way that you perceive yourself or perceive the world.
Let's get specific, if you would.
Sure. So, say someone, I'll give a specific example. I have permission to use this person as an example. Someone that I work with grew up in a family that had many siblings, and depressed and very, very overextended mom, and dad was no longer alive. So the family was struggling financially, and there was a sense of poverty that they had. But because of mom's depression, and most likely also, and now in hindsight, I can see this because of her trauma, right? What she sort of was handing down to this panic and guilt and shame associated with not having money, that she blamed it on the children, why she didn't have money. And she blamed it on them being so expensive and that they were draining her dry. And this was when the kids were young. They weren't asking for cars. This was just putting food on the table and keeping the house rent paid and so on and so forth. But this person now is an adult. He grew up as the youngest, and he has an incredibly hard time, two things: spending any money or asking anybody to do anything for him. Now, he just thought he was prudent, financially resourceful and intelligent. And he also thought that he was being an independent, man, that you lean on yourself, you don't lean on others. As we sort of explored it, we could see that part of this came from what he inherited from his mom in terms of her anxiety and her closeness, her limitations about money and how scary it was not to have it. And that he felt like he was in some way still trying to make up for that, trying to get her approval, trying to unmake the mistake, trying to show that he's not such a drain on money. He won't be a drain on somebody else. So it limited how close he could get to people and whether he could receive affection. It sort of, so our early experiences both have their own direct wound, right? But the ripples of this frequently come out into the ways that people relate with each other, the way that we relate with ourselves. It's even more subtle than the outward behavior. It's just how we are feeling and how we communicate that to others in the world. Like you see this now, right? Like never before has the world been showing, at least to me, such raw examples of people being in such a sustained fight response, just enraged, right? Yeah. And that makes my nervous system feel less safe because this is going on. And I think that all of our nervous systems are perceiving that at some level, right?
Definitely.
So I think that, one of the things that we teach in the course, one of the things that's really important to me as an individual too, is also sort of helping people see that we don't have to be imprisoned by these habit patterns of beliefs and of limitations or of shame or of the burden of unresolved trauma, this does not have to stay in your body or in your mind, that we don't have to be prisoners to that, right? It's harm enough to go through a difficult experience, right? Once, let alone for some people, hundreds or thousands of times. But then beyond that, to have not only that pain, but then the pain of somehow I caused this, or I didn't do enough to stop this, or I deserve this, or I was told I deserve this, or someone told me not to go there, but I went there anyways. So we have the pain of the original affront or wound or betrayal or attack, but then we have on top of that, and this is where trauma and abuse in many, many ways, that they make it complicated because it pulls in this self-blame, this self-shaming that I've created this pain, that somehow there's something ugly or bad in me, and that's what's caused this, right? Mm-hmm. And to me, over time with trauma, that is one of the deepest legacies I think that people have, is this tendency to still carry and embody shame, right? And it can be very subtle in little things. I had someone else I worked with who, and this is not uncommon, that they kept putting off going to an annual physician visit because their father had cancer at about the age that they were getting to, and they just didn't want to go, and they didn't want to go, and they didn't want to go. And they didn't realize that it was both part of their fear of dad, but also their shame that they didn't feel like they deserved to live longer than him while getting taken care of.
Wow.
Right? So there was this unconscious, I'm going to avoid doing this. I'm busy. I've got other things going on. But really what was going on when he worked into it and felt into it was much more that he felt guilt about breaking this thing that, dad didn't take care of himself. So why should I right now?
Wow.
Right.
Man, the way you're describing this, it's just so relatable. I mean, these are very real feelings, normal feelings that a lot of us have. I mean, just feeling shame about these things. And it's the difficulty oftentimes, or the challenge can be getting the awareness, right?
Absolutely.
Initially.
Yes, I think that's a big piece of it. Most of the time when we're in shame, we're in a trance, right? We don't even know that we're in shame. We just think, oh, my brain's telling me the truth. When we're in anger, we're in a trance. We sometimes don't even know we're angry. We just think I'm perceiving reality and it sucks. And I'm angry at reality instead of maybe something's going on. We listen to our states, and the state of all that we listen to the most is the states that are self-critical. The ones that emphasize the energy of shame, judgment, condemnation, the idea of not being enoughness, something inside of you is raw or uncooked or undone, or just frankly, universally, essentially not enough. That's the message of that. And so many people have that infiltrate their thoughts, infiltrate their behaviors. And if not in overt ways, in subtle ways. For example, I work with a bunch of people who've had some trauma in their lives, and all of them developed a tendency for perfectionism. Now, to me, trying to be perfect is kind of also the flip side of shame. I want to be the opposite of shame. I want to be beyond reproach, because if I'm beyond reproach, people will care or remain connected with me in relationship or value me or won't fire me. But it's that perfectionism, right, that also limits their life. They're so worried about being perfect that they have no time for enjoyment or no time for taking care of their needs or self-care, because it's all about survival. It's all about focusing. And in those ways, our awareness gets hijacked by the states that we find ourselves dominantly in. And so you're right that the first step is beginning to even become aware in yourself that that's what's happening, right? Like to be able to catch in the moment, either the shift in thoughts or narratives. So for me, right, my shame is a frequent visitor. And when it comes knocking, around the same time that a thought will occur, I'll have this feeling in my upper stomach and chest of a kind of contraction and falling at the same time, kind of contraction and just opening up. But a thought will come into my head of some anxious thought about something I've messed up or effed up beyond repair. And it's that element of I've done it. It's already beyond repair. I'm screwed. That starts that kind of a cycle. And it's over nothing. It's over when I'm not in shame. I immediately know, what are you talking about? But in that moment, for that second, it feels totally real, totally believable, and I can get usurped by it. So part of it is beginning to notice when we get usurped by it. And part of it is also learning how to stay more present in the body versus just getting lost in the story of shame, because the story of shame is quite seductive. It'll just pull you in, right? I imagine, like a cartoon that has someone standing there and they're having a thought. It's a little bit of shame and it turns into this dark cloud. And the next second, all you see is empty tennis shoes and empty socks. Because they've gotten sucked into this cloud of shame. That's where we go. Like we lose our grounding. We lose something else. You go into this very interesting and very pained, very separate place where no one can save you, right? Because when you're feeling shame, and I think our listeners would understand this too, is that when you're feeling the intensity of shame in that moment, if someone tries to say, you have nothing to be ashamed about, usually that gets bounced out within a second. I'm sorry, I'm in shame. You clearly don't know. I've messed up. This is the world's worst messed up. This isn't just a minor mess up. This is unforgivable. You don't understand the scope of this, right? So part of that is beginning to see that we live. And this is part of what we teach in the program. Part of also my approach is that it's based on being aware of our states, being aware that a lot of our perception, interaction with reality is determined and it's filtered through our states. So if you or anybody becomes anxious, two things will happen. Your brain will start projecting future and will start projecting catastrophic events. Oh my God, I'm going to die, or the world's going to end, or I'm going to lose the person I love, or this job is not going to work now, whatever that is, right? Those are the two things. Anxiety will take you to some future event, not in the immediate moment. It'll be still moments from now or years or days from now. And most of the time, if people are chronically anxious, they just think that's reality. That's who they are. They don't understand that as long as they're that anxious, that anxiety is still casting a spell on their life. If they're that ashamed, that's casting a spell. If you're that chronically angry, irritable, that's casting a spell, because each time you're in one of those states, your mind is not really your own. It's being driven by the physiology of the state. And that includes what you think and amplifying what you feel, right? And instead of seeing this as, oh, I'm in this state or that state, it's like, oh, I'm angry. Well, in that moment you are. I don't know about you, but I have been so angry than to go to sleep and wake up the next day and wonder why I was so angry the night before. Like, it's laughable, right? In other words, depending on our state, it feels like absolute truth or not so much.
Let me just pause here for a moment to thank our sponsors. I want to remind everyone that I'm speaking with Dr. Jeffrey Rutstein. We'll be back in 1 second. All right. So, wow, I'm listening to you. I'm identifying a lot with what you're saying and thinking that it's oftentimes very subtle, and yet these subtleties can oftentimes lead people to extreme behavior, right? And you talked about masochism and so forth. And oftentimes it's at those points when people seek help, right? It's oftentimes not when you're in the midst of these subtleties, you're like, well, this is who I am. How do you, and I want to talk about the course, but how do you begin when you're working with someone, begin to work with someone in this state that you're talking about? How do you approach working with someone?
Well, a bit of what I do right now is I do, like I used to do with more traditional trauma work, is I would do a little bit of education about state. So I do that now with everyone. And about the idea that, like, for example, if you've had trauma, you're going to be chances are you're going to be chronically in fight or flight, or you're going to be chronically more drawn towards that lower energy we call dorsal vagal. And that has all the range of depression, dissociation, shutdown, collapse, feigned death. It's that whole type of very contracted, collapsing energy. Or we can go high energy, angry or afraid. And that most of the people I see have some level of trauma in their background. And we talk about how that impacts their nervous system. And then their nervous system, without them knowing it, drives them, right? That unresolved trauma lives in the body and lives in the nervous system and tends to make people feel a little bit like a ping pong ball to outside events, instead of feeling like they're self-authoring a little bit. Not that you can control reality, but the feeling is that you're not always getting thrown for such a loop.
Mm.
Whether it's suddenly not having feelings, or suddenly having a strong feeling, or suddenly feeling really enraged without knowing why, or suddenly needing to cry. Those kinds of sudden intrusions really begin to dissipate and slow down the more that someone understands both what we call dysregulation, being in one of the defensive states, and how to move towards regulation. So regulation, the ability to self-regulate, is not saying that we're always in perfect control. That's not true. It just means that we don't have to get stuck longer than necessary, and that's a variable, necessary. We don't get stuck in an overreaction or an under energy shutdown reaction for eternity, right? And many of us know that if you've had problems with anger and you get caught in anger, you can get caught in anger for a long time. When I was a kid, I could have a temper. I could be angry for a couple of days, and I wouldn't know how to get out of it. So when any of us get in a state of anger or sadness, intense states for days, it's extremely painful, causes tremendous suffering, and it's not helpful in terms of they're not doing something wrong, but it's not necessarily doing something that will help someone move forward. It just sort of keeps that neural pattern going.
Mm.
So the beginning is explaining a bit of that, and then helping people understand a few things about what they're prone to in their nervous system. We talk a little bit also about how this impacts how they perceive their spouse or their boss or their kids, right? And why they have trouble when their adolescent suddenly raises his now masculine voice. He now has a voice 2 octaves deeper. And now when he gets angry, she gets triggered where she didn't get triggered before, right? So she's becoming aware of these changes outside or eliciting different changes in her nervous system as well, as he now goes from safe in her nervous system to unsafe when he's angry.
Okay. And before we start talking about the book, what is it within you, Jeffrey, that you feel allows you to do this work the way you do it?
I don't know if it's allowing. I feel like I'm able to bring all of my life to my work, consciously and unconsciously, right? So everything that I've gone through individually, all the wonderful, lovely things that I've experienced, and all the painful things I've experienced and the losses, they have all informed who I am as a human. And once we understand, especially if I think my practice also helps a lot with this, getting more specific, because a meditation or awareness practice really does train us to be able to be a participant observer, but we're able to really be with things as they are, not necessarily totally separated as a witness, but being there in a very present and bright way, but being more of the process of watching, bearing witness, versus getting carried away into the reactivity. But you can see the reactivity, you can feel it, you can actually have a relationship with it, but you don't get carried away. I think that my own work like that, as well as my own, trainings over the years, has got to me where I feel like I can bring that resource and help other people find that resource in themselves, which is that until you see that fear or shame, for example, are just states, and that they're just based on the state-generated thoughts that are making you afraid, that there's actually nothing to be afraid about unless there's something in this very minute, like the building's on fire. Yes, be afraid, run. Mm-hmm. But if this is about the house may be burned down in 3 days or in 10 days, it's not the same thing. It's just staying in a loop. That's not necessary. So yeah, I think it all contributes to me bringing what I bring.
Sharing that. Awesome answer. So let's talk about this course. It's in partnership with Sounds True.
Yeah.
And it's called the Healing Trauma Program. Give us the snapshot and let our listeners know what it's about, who it's for, and when they can sign up for it if they're interested.
Great. So the program is a 9-month program. It's a long program, right? The program is designed not as an intellectual tour of theory about trauma, but it's designed as a deeply experiential dive into learning how to embody these particular awareness and somatic-based practices, body-based practices. So the course we found in research, this has been found in other mindfulness programs, for example, is that it takes 9 months to a year to actually embed a skill. You can learn a good skill in 3 months, but to really have it embedded, to be something that it actually begins to change the way that you see and relate to yourself and the world, that takes 9 to 12 months to be set. So that's one of the intentions of this program, is to really try to offer people enough time and enough guidance through those 9 months to actually experience a transformation in the way that they relate to themselves and in the way that they relate to others, by seeing their own ability to be dysregulated, or hopefully many of our folks who graduated the program have increased their ability to self-regulate, to drop into that much more present, we call it the ventral area, the ventral vagus response. It's a more relaxed, present, connected, compassionate, creative space. It's a non-contracted space. And that's a place that is healing in and of itself. And it's easeful, right? And that's such a tonic for chronic stress, chronic contraction. And so many of us suffer, whether you've had a trauma background or not, so many of us suffer from a tendency to be stressed by our own internal dynamics.
Is this for therapists and non-therapists alike, for anyone?
It's for anyone.
Okay.
It's geared, each person we're really gearing this more towards embodying it themselves. So this is not so much about teaching it. We may be adding a component this year or next year that will be specifically aimed at teaching how that this is taught. But the program itself is for someone who really wants to be able to not be controlled by their nervous system. And the 3 trimesters are trauma in the body. We go on a dive in terms of how it affects your own nervous system and body, trauma in relationships, how your nervous system impacts someone else's nervous system. And each month you're also given practices that are a part of the embodiment thing. We have a lot of live meetings that support people's learning and people's practicing. The second trimester is trauma in relationships, and the third trimester is trauma and the collective. And the idea that at this point in time, between intergenerational trauma and collective trauma, most of us, if not all of us, have some level of genetic trauma in us, even if we ourselves have not experienced the trauma, and maybe even our parents didn't, but in likelihood, your grandparents, great-grandparents, or great-great-grandparents went through a war, a famine, a fire, an illness, the influenza, that somewhere in your personal lineage, there's some trauma, that somewhere in your cultural lineage, there's trauma. If there's a racial lineage, there's trauma. And so in the third part of the program, we look at the idea that so much of dysregulated behavior is actually caused by this lineage upon lineage of unmetabolized trauma.
Wow.
But I think that supports the tendency for people to ease into hatred instead of into connection. That it's easier to make a judgment and hate an other than to form connections based on we're all human.
Go over that again. I just want to make sure I get that. To ease into hatred. Say more about that.
The idea is that it's easier to have hatred, to be afraid and to be angry. That's easier for us to defend ourselves with, and we find that we hold tight to our identity. But this is mostly also needs someone that we can be afraid of or hateful at. And so this tendency, which is evolutionarily defined, but it runs, it's like no one thought about this. This is just what's occurred in the nervous system over time since we were just mammals. The idea is that this is what's running. It's this autopilot of needing to other, needing to have aggression, needing to have someone who's wrong. You can see this in personal relationships, and you can see this between countries, between religious groups, and between political groups. It's happening more and more. that's really primarily coming from this idea of a very binary hate, good, bad dichotomy. When you're more regulated, you're able to connect with differences and similarities without being threatened by them.
Right.
When I'm angry, it's hard for me to do that, right? So that third trimester sort of supports this idea that the more regulated you are, the more that you can offer that kind of healing just by your presence alone, right? It's not even what people say. It's the energy that goes with it. It's the tone that goes with it, right? Right. There's always been political debate, but today's political debate seems to have much more hostility and aggression in it than ever before. So it's more raw. It's more raw in the air. And I think that if people understand that this is really state defined, and more of us that can sort of become aware of and connected with how our own state impacts our ability to be present, to not be enslaved to our past, but to actually be free and liberated more about how we want to live our life now, that the more that people are doing that, the less you'll be impacted by other people's extreme state dysregulation. The less that you'll be up sleepless nights, because there's a lot of people up sleepless nights, right? Like that, there's that energy or that worry about worry, right?
Yeah. Wow. So basically this program is for all of us.
Yes.
We all.
Yes.
Sounds amazing. Yes. So the Healing Trauma Program, we'll have that linked up here at the show notes page at the traumatherapistpodcast.com. When can people sign up for this? When is the next cohort?
So the next cohort will begin in January, February of 2024. The registration will open up in October. We got full this year by the end of November. So if people are interested, they can look it up there. They can go to Sounds True. I think we have the link from the other year for that. If not, I can send that to you.
Okay.
And again, we have 13 great speakers: Gabor Mate, Peter Levine, Resmer Menachem, Ruth King, Thomas Hubel, Ariel Schwartz, Judith Blackstone. We have some really, really wonderful folks with us who are teaching each month as well. So there will be great and deep knowledge offered about the dynamics of trauma. And then there will also be this whole intense practice support that's also in there.
Wow. Sounds incredibly rich. Jeffrey, you're incredible. I mean, you're so inspiring. The way you are able to articulate what you're doing and bring your experience and heart into it is why I love having you on this podcast. I want to thank you so much.
Thank you. Thank you for having me. I always have a pleasure being with you.
All right. We'll be in touch. Thank you.
Thank you, Guy.